Bismillahirrahmanirrahim. So today we are going to study about the third first line anti-tubercular drugs, and this is the lectures regarding the anti-tubercular drugs. So today we are going to study about the ethambutol. So let's start. So first of all, talking about its mechanism of action, that how does the ethambutol works. So it works mainly by inhibiting the mycobacterial ribinosyl transferase enzyme, and this ribinosyl transferase enzyme is mainly encoded by the gene known as MBB gene. This ribinosyl transferase is involved in the polymerization reaction of arabinoglycan, and this arabinoglycan is an essential component of mycobacterial cell wall. For example, these are the arabinoglycan components, and what this arabinosyl transferase do, they are involved in the polymerization of this arabinoglycan and thus helps in the cell membrane. This is cell membrane synthesis. So inhibiting this ribinosyl transferase will inhibit the synthesis of mycobacterial cell membrane and thus will helps in the death of this Mycobacterium tuberculosis. Now coming towards the resistant, that how the bacteria develop resistance against this ethambutol. So it is mainly due to the mutations in the EMBB gene, and these mutations will result in the overexpression of EMBB gene products, or it may be due to the mutation in the structural gene of EMBB. So both of these can result in the resistance towards the ribinosyl, towards the ethambutol by the Mycobacterium tuberculosis. Now coming towards the pharmacokinetics. So first of all, they are well absorbed from the gut. After the oral administration, they are distributed widely in the body, and this ethambutol can cross the blood-brain barrier only when the meninges are inflamed. In normal cases, when there is no meningitis or no inflammation, this ethambutol cannot cross the blood-brain barrier. It is mainly metabolized in the liver, and they are excreted mainly in the urine, about 50% in the urine in unchanged form, and about 20% is excreted in feces. So in case of renal failure, this ethambutol accumulates in the body, so the dose adjustment must be done, and if the creatinine clearance is less than 10 milliliter per minute, so the dose should be reduced by about half. You would see the creatinine clearance, if it is less than 10 milliliter per minute, so the dose should be reduced by half in case of renal failure. Now talking about its uses, so mainly it is used for the treatment of tuberculosis. It is also used for the tuberculous meningitis in higher doses, not in the normal or low doses. It is effective even in the Mycobacterium avium complex infections. So for the tuberculosis, tubercular meningitis, and the Mycobacterium avium complex infections. So these were some uses of the ethambutol. Now talking about the side effects, so mainly the ethambutol is well tolerated. They are well tolerated, but they may cause side effects like the optic neuritis, which is the most important and severe adverse effect, and serious or severe adverse effect, and it is in the form of retrobulbar neuritis, and this retrobulbar neuritis or optic neuritis result in the loss of visual acuity and red-green color blindness. It results in the loss of visual acuity and red-green color blindness, and it is mainly dose related. It occurs when the dose is about 25 milligram per kg per day, and when it is continued for several months. At 15 milligram per kg per day or less, the visual disturbance are very rare. It occurs at higher doses above 25 milligram per kg per day. So periodic visual acuity testing is done or desirable if the dose used is above 25 milligram per kg per day. Also, this ethambutol is relatively contraindicated in the children, and those children which are less than 6 years of age, because they are too young to permit the assessment of visual acuity and red-green color blind discrimination. So the ethambutol is relatively contraindicated in the children less than 6 years per age. Now coming towards the other side effects. So it also causes hypersensitivity reaction, but they are very rare and they may be in the form of skin rashes, itching, joint pain, and myalgia. They also cause hyperuricemia due to the decrease in the clearance of ureates by this ethambutol, and this hyperuricemia can exacerbate the gout. They also cause GI disturbance like nausea, vomiting, and abdominal pain.